Welcome to my Zen Microdermalift online class featuring the one and only Dermafile by Be Stunning, made for and sold exclusively to estheticians. Before I begin this technique, I like to review with my client to make sure that there's been no change in their medical status and that there aren't any contraindications. I also like to take a before picture. The changes that your client will see after are astounding. So let's get started. To begin, you can use any product. This technique is product neutral, so whatever you have is going to work really well. In this video, I'm using from my private label an oxygen mask, but it works fantastically well with any cleanser or any enzyme as long as that enzyme is not a gommage. You want to start at the center of the décolleté, lateral to the sternum. These strokes move in one direction from the center of the body laterally to flush metabolic waste and lactic acid. The stroke goes in one direction from the center of the body laterally. This is a weighted tool, so just let the weight of the tool do the work. You don't have to press hard. It is also ergonomically set up so that you don't have to strain your wrist or your shoulders, so adjust your body so that you are comfortable. I like to stay in one place and do that stroke about 4 or 5 times and then run my hand across it and make sure that the tone and texture all feel consistent. When I'm done with the décolleté, I like to rotate the head to the side to make the skin more taut and begin the lifting technique. I'm going to start superior to the clavicle and work all the way up to the inferior jawbone. Again, staying in one place about 4 or 5 times to make sure that I get a complete polish. You want to avoid firm pressure over the thyroid or the trachea. When I'm done with the neck area, and I like to work just one side of the body at a time so that I can be sure that I've got a good visual and can avoid any elevated moles or pimples, cherry angiomas, skin tags, or other skin irregularities. You need to have a good visual on that. It doesn't feel good to have that polished. So again, I'm moving from the center of the face, the mentalis, laterally out towards the ears. This is going to help with any puffiness or swelling on the face. That stroke is lateral, but in also a lifting fashion so that we're going to begin to strengthen, firm, and tone the muscles. Again, the stroke moves in one direction from the center of the face laterally. I like to finish all the large areas first and then come back and do the detail work. Around the nose, I like to turn the tool upside down and just work the tool on edge. This tool is triple diamond encrusted, and that incrustation wraps around the edge of the tool so that you can do a little bit more finite work in a small area. For this technique, you want to stay outside the orbital bone. Do not go into the soft tissue within the bone around the eye. For this area here, I like to work in a cross-fibering fashion. So when I get to the crow's feet around the eyes, I want to work it in a cross-fibering technique. If those lines run vertical, I'm going to erase them going in the opposite direction. Smooth it out and make sure everything feels good. The same is going to be true for the 11s. Those 11s run in a vertical fashion, so I'm going to cross fiber them by working them horizontally. Again, this is going to remove the skin and soften the tissue underlying. This is going to be true for any muscle on the face. Whatever the line or crease is, take the tool and work it in the opposite direction to soften the fine line or wrinkle. You want to look closely at your client's skin to make sure that they're not having any adverse reactions. A little erythema is normal, but if you're starting to see a reaction, you might want to lighten up or stop the treatment. To work into the hairline, I like to turn the tool over. This is fantastic if your client is starting to have a receding hairline. It's great to clear up any congestion in those follicles. I do the same as a little backstroke through the eyebrows to keep that area exfoliated as well. I don't recommend it if your client has a microbladed eyebrow. Once I've completed one side of the face, I like to go back and recheck, make sure that everything is nice and smooth and consistent, and then I start again on the other side down at the décolleté. This time I'm moving superior to the clavicle all the way up to the inferior jawbone, avoiding the thyroid. And if the skin is not taut enough, I like to depress it down just a bit to get it nice and firm. This is a metal tool, so you don't want to be banging it against the bone, so make sure that you're aware of your structure. There are many benefits to this technique, from softening and smoothing out fine lines. It's going to stimulate blood circulation and detoxification. This helps with the lactic acid and metabolic flush, and it's going to accelerate collagen synthesis. It balances muscle tone and texture and is an easy add-on service to any facial that you are currently offering. The biggest benefit I see from this one is that it balances uneven pigmentation and helps to clear out congested pores. The nicest thing about it is it's very versatile. It can be added on very quickly to any facial. It requires no electricity and no fiddling around with any filters or anything like that. Super easy to travel with and an easy add-on, or it can be done as a standalone surface. Always making sure to move that stroke in one direction from the center of the face laterally, polishing while you are flushing lactic acid. Working the edge of the tool into the smaller areas and taking that stroke all the way out to the ear. Making sure to avoid the orbital bone. From an ergonomic standpoint as a practitioner, make sure that you're sitting tall, your shoulders stacked over your hips, and your elbow in nice and close to your body. This is going to reduce fatigue on your body. Again, this tool is weighted, so just let the weight of the tool do all the work. You don't have to press hard. A couple of contraindications that will come up is this technique okay to use with Botox or fillers? And the answer is yes. We are working more superficial than that, but you want to let that Botox kind of get in and get settled for at least 2 weeks. It is also okay to work with any fillers. But again, give those fillers a couple weeks to really get settled in before you start manipulating them. Like I said, this technique is going to bring erythema to the surface of the skin. So when I get done with this treatment, I always like to follow it up with either a nice calming mask, or I like to do some type of cryo treatment post. One of the most important parts that you need to know about this tool in order so that it will last you 6 to 10 years is how to take care of it. Once you are done with your treatment, in the bathroom with a soft toothbrush and hot soapy water antibacterial soap, you're going to get off all the large product and skin. From there, you're going to stick it into a hospital-grade enzyme detergent for 10 to 15 minutes. From there, take it back out, rinse it off again with your toothbrush and hot water antibacterial soap, and then you're going to put it into your hospital-grade disinfecting solution for about 10 to 15 minutes. You don't want to leave it on too long because you don't want to break down that incrustation process. So 10 to 15 minutes in each, take them out, pat them dry, and store them safely. Thank you so much for watching.